Welcome to Logical Ayurveda. Nowadays, when you go near a pediatric hospital during rainy season or during a cold season, you can see flocks of babies, masses of babies along with their parents coming to the pediatric allopathic doctor and seeing for the same disease again and again, for same fever, same cough that is there since a week, since 15 days, since a month, and they are getting treated for the same. They are being kept nebulizer for the same. They are being admitted for the same. So it is very painful to see those patients waiting in long queues and not getting cured. But when those pediatric babies come to an Ayurvedic doctor and take the medicines patiently, very rarely these babies come back again and again with the same disease, and at a period of time they develop immunity, and very rarely and during a striking climatic change only they come to the doctor, and they don't come so often because good Ayurvedic doctor always teaches them what basic medicines to be given in fever and certain conditions, what difference in patya apatya should be done, so that they make sure that the particular baby has a immunity and does not develop fever again and again. So it makes me stress one thing more. Ayurveda is the best solution for solving repeated pediatric ailments and give immunity to the pediatric patients all over the world. As a responsible doctor to the society, as a responsible Ayurveda doctor to the society, we have the job of keeping the children free from erratic and irresponsible use of antibiotics and steroids. I am not telling every doctor does that. There are people who do that. There are people who use steroids recklessly. There are people who use antibiotics recklessly, even for small pediatric ailments. And eventually those children develop resistance to the particular antibiotics and other medicines. What I am telling is, as a responsible doctor of the society, we have the job of keeping the children free from this erratic and irresponsible use of antibiotics and steroids, and give them immunity so that those antibiotics and those steroids can be best used when there is a real emergency condition, when there is a horrible emergency condition, when there is a striking emergency condition like pneumonia, COVID, etc. That time that antibiotics and steroids should give results, not in normal fever, normal cough, normal rhinitis. Okay, those antibiotics and steroids can be best put to use in emergency condition. For that, in emergency condition, such particular medicine should not give resistance, should give results. When they will not give resistance, when they will give results, when they are not used so much often. Okay, when you use an antibiotic for 10th time, 11th time, same antibiotic will not give result. But when you use Amrita Arishtam for 50th time, but when you use Amrita Arishtam for 500th time, even 501 time, during the 501 time also, it will give the same result to the patient, but it is not the same case with the antibiotics. But I'm not blaming antibiotics should not be used. They should be best used. They are needed in the condition of real emergency. In the condition when the patient should get immediate cure. In the condition when the patient has mass infection. It should be spared for that time, not for normal time.